My name is Carrie Peterson. I'm a colorectal surgeon at Froedtert Medical College. I specialize in diseases of the colon, rectum, and anus. I'm a native of Wisconsin. I grew up in the area and went to medical school here, actually. After finishing medical school, I went and did my general surgery training at the University of California, San Diego, and spent a total of 7 years there, including 2 additional years for surgical research. Following that, I went to New York and did a fellowship in colorectal oncology at Memorial Sloan Kettering Cancer Center, and then another year of colorectal surgery at New York Presbyterian Hospital and Weill Cornell Medical Center. I joined the faculty here in 2014. So I treat the whole spectrum of colorectal diseases. So a large practice of mine is colorectal cancer, so colon cancer and rectal cancer. I also treat inflammatory bowel disease like ulcerative colitis and Crohn's disease. I do a fair amount of diverticulitis surgery as well. And then I treat a wide spectrum of anorectal disorders, everything from hemorrhoids to fecal incontinence to fistulas as well. I do a lot of minimally invasive surgery for whatever disease process I'm treating, both a laparoscopic approach and a robotic approach. And a minimally invasive approach is really wonderful for patients because it allows them to recover faster, it has less pain, it has fewer complications, and less blood loss. So there's a huge advantage for patients in being able to offer those techniques, even for complicated diseases like diverticulitis and rectal cancer, where it's fairly uncommon. When we talk about rectal cancer, quality of life is huge because many patients just assume they're going to need a permanent bag. But in the right patient, we can avoid that and spare the muscles that help you control your bowel movements and avoid a permanent ostomy. Rectal cancer can be really hard to treat. There's a lot of different options that can be really confusing to patients: chemotherapy, radiation, and surgery. In addition, the recommendations have really changed a lot in the last few years so that it becomes really confusing as to what the best option is for patients. We have a multidisciplinary approach to rectal cancer care here, where we collaborate with our oncology colleagues, radiation oncology colleagues, pathologists, and radiologists to come up with the best treatment plan for each individual patient, which really allows us to capitalize on everybody's specific level of expertise. I think I can offer the robotic surgery as a minimally invasive platform, which is unique here at Froedtert in the Medical College. It's not something that a lot of colorectal surgeons do. In addition, being a woman, I offer a unique perspective when it comes to treating especially women patients. And I think that's much appreciated, and I certainly like that when I go to my doctors. Seeing a specialist for colorectal diseases is, I think, always a good idea. We offer a unique perspective that a general practitioner or a general surgeon may not be completely aware of. Our additional training, in my case 2 additional years, really exposed me to a lot of different options, a lot of different techniques that are available to treat a variety of different diseases. I work on a number of different clinical research trials. I have a particular interest in what we call enhanced recovery after surgery. So ways that we can make recovery after surgery less impactful for patients, make their recovery faster, and make the risk of complications less. And so that's been a research focus of mine, particularly working on how we can manage postoperative pain without requiring strong narcotic medications, or at least as little as possible. As a teaching hospital of the Medical College of Wisconsin, we have residents and students who are involved with patient care, and I think that's a great opportunity, 1, for them, and then 2, for patients to essentially be the teachers and help us teach the next generation. And I think that teaching is a cornerstone of being a physician. We're constantly teaching. We're teaching our patients, we're teaching our colleagues, and we're teaching the future generations.